You know that feeling, right? That nagging, burning, or kind of gnawing pain right there in your upper stomach that just hangs around. It's such a common thing to feel, and for millions of people, it's actually the very first sign that something's off inside their digestive system. So, what is a peptic ulcer, really? Well, the simplest way to think about it is an open sore. Seriously, imagine a little crater forming on the inside wall of your stomach or the top part of your intestine. It happens when the powerful stuff your body uses to digest food actually starts to digest the lining of the organs themselves. And that gets us to this idea of a shield. See, your digestive tract has this amazing, tough mucus lining that's designed to protect it from all that corrosive acid and digestive enzymes. With peptic ulcer disease, something has broken through that shield. The defense is down, and the tissue underneath is left totally exposed and vulnerable. So, first up, let's get a really clear picture of these unseen sores, where they actually show up and which kind is the most common. Okay, this is probably going to surprise you. We tend to call them stomach ulcers, right? But get this, a staggering 80% of them aren't even in the stomach. They happen in the duodenum, which is that very first section of the small intestine, right where it connects to the stomach. Only about 20% are actual stomach ulcers. For the longest time, I mean decades, people just assumed ulcers were caused by stress or eating too much spicy food. But, well, the science tells a completely different story. It's time to unmask the real culprits that are breaking down that protective shield. And here they are, the two primary villains in this story. On one side, you've got a bacteria called H. pylori. It's super common, and it can just live in your stomach lining without causing any trouble. But if it starts to overgrow, it can do some serious damage. And on the other side, overusing NSAIDs. We're talking about common painkillers like aspirin and ibuprofen. Taking them too often can really mess with your stomach's natural defense system. Now, while H. pylori and NSAIDs are the big headliners, they sometimes have a few supporting actors. Things like smoking or drinking too much alcohol. They don't usually cause an ulcer all by themselves, but they can absolutely make a bad situation worse and really increase your risk, especially if one of the main culprits is already there. So now that we know what's causing all this damage, how would you even know you have an ulcer? Let's tune in and listen to the signals your body is sending. And get ready for another shocker, because this is wild. Up to 70% of people who have peptic ulcers feel absolutely nothing. Zero symptoms. They're walking around with these sores inside them and are totally unaware, which is exactly why it is so crucial to pay attention when your body does send a signal. For that other 30% who do feel it, the symptoms are pretty distinct. That classic sign is the burning, gnawing stomach pain. A lot of people just mistake it for bad indigestion, but you might also feel bloated, full, find yourself burping a lot, get heartburn, lose your appetite, or even feel nauseous. Okay, I need to get really serious for a second because this is critically important. If that dull ache suddenly turns into a sharp, stabbing pain, or, and this is a big one, if you ever see blood in your stool or your vomit, which can sometimes look like dark coffee grounds, that is a medical emergency. Go get care immediately. And this is exactly why you can't ignore those signs. An untreated ulcer is not just an inconvenience. It can become a really dangerous, life-threatening problem. It can lead to internal bleeding, or worst-case scenario, a perforation. We're talking a literal hole punched right through the wall of your stomach or intestine. So after all that serious talk, let's pivot to the really positive side of this story. Because once an ulcer gets identified, the path to healing is actually super clear and really, really effective. Figuring out if you have an ulcer is surprisingly straightforward. Doctors can start with simple breath or stool tests to check for H. pylori. They might do some imaging, like a CT scan, to get a look, or they can use what's called the gold standard, an upper endoscopy, where a tiny camera goes down and gives them a direct look at the lining of your stomach. And this leads us to the most important message of hope here. You don't need to panic. The vast majority of peptic ulcers heal up just fine with medication. Surgery is extremely rare these days, and it's almost only for those really severe complications we just talked about. The medication strategy is actually kind of brilliant. It's a three-pronged attack. First, if H. pylori is the problem, you take antibiotics to get rid of the infection. Simple. Second, you take medicines that lower the amount of stomach acid, which gives the ulcer a chance to breathe and heal. And finally, some meds can actually coat the ulcer, creating a protective layer to shield it while it heals.
Okay, so we've covered the what, the why, and the how to fix it. Let's wrap up by talking about the long game, what life looks like after an ulcer and how you can stop them from making a comeback.
The outlook is excellent. Seriously, most people can expect their ulcer to be healed within just a few weeks of starting their meds. The whole course of treatment usually lasts about 2 months. All in all, it's a pretty quick and incredibly effective recovery. So, what's the big takeaway for prevention? It all comes right back to our two main culprits. Number one, find out if you have an H. pylori infection and get it treated. And number two, be super careful with NSAID pain relievers. Use them only as directed, and if you've had ulcers before, definitely talk to your doctor about safer options. When you really think about it, peptic ulcer disease is the perfect example of why it's so important to listen to our bodies. That pain, that discomfort, it isn't something you should just ignore or cover up. It's a clear signal that your body's defenses have been breached. So the real question is, are you listening?